I'm PetronellaVanTonder, diabetes educator in Centurion, South Africa. Today we are going to talk about cardiovascular disease and the major risk factors for people living with diabetes. The cardiovascular system literally means cardio or heart, and vascular literally means system of blood vessels which is vital for living. The cardiovascular system can also be seen as a pump, the heart, and an extensive piping system, the blood vessels. The vessels away from the heart are the arteries that carry oxygen and nutrient-rich blood to all the organs and tissues in the body. Our discussion will be limited to the larger blood vessels which supply blood to your heart, brain and feet. And important, the major risk factors that can help to increase the risk for this disease. Did you know that people with diabetes are 2 to 4 times more likely to develop coronary heart disease, and that can follow by a related heart attack and or death as compared to the general population, and a double risk of a stroke. People with diabetes also have a 4 times higher risk of developing peripheral vascular disease, which may lead to feet or leg amputations. Heart attack and angina, also called coronary heart disease. This situation occurs when the blood flow to a certain area of the heart muscle is impaired due to a narrowing of a total blockage of one or more of the arteries to the heart. Stroke or cerebrovascular disease. This is caused from either a blockage or a narrowing of the blood vessel to the brain. Impaired blood flow to the legs and feet, also called peripheral vascular disease. This affects the major arteries supplying blood to the upper and lower limb, and with the added effect of disease to the smaller blood vessels can lead to the loss of a limb. Well, you can establish your risk factors and manage them. The average value recommended are less than 140 over 90 mm mercury for the population at large, and 130 over 80 mm mercury or less for patients with diabetes. HDL cholesterol or good cholesterol more than 1.0 millimole per liter for men and more than 1.2 millimole per liter for women. Triglycerides less than 1.7 millimole per liter. However, a change of lifestyle risk factors are the most important to manage cardiovascular disease, and they are cigarette or tobacco smoking. You have to stop immediately. Smoking is an important reversible risk factor for cardiovascular disease. Heavy alcohol use is a no-no. If you consume alcohol, you should do so in moderation. That means 1 unit per day or less for women and 2 units or less per day for men. Hyperglycemia or high blood glucose readings. Your HbA1c are great when you are around about 7%, and you can infer that your average blood glucose readings during the past 3 to 6 months has been within an acceptable range. If your blood glucose machine display levels of 4 to 7 millimole per liter early in the morning, meaning fasting blood glucose, and postprandial blood glucose of 5 to 10 millimoles, meaning readings 2 hours after meals, then you know that your glucose levels are within an acceptable range. Overweight, obesity and healthy eating habits. Portion size is important when discussing healthy eating habits. Eat a variety of fresh vegetables and fruit every day, as big as 2 open handfuls, but avoid fruit juices. Eat starches, also called carbohydrates, such as breads or grains chosen from the whole grain product list available, the size of the fist of your hand, and include products that contain approximately 10 to 20 grams of fiber per day. The use of low-fat dairy products and soya beverages fortified with calcium are preferred, 1 cup per day. Proteins the size of the palm of your hand. Eat a variety of lean meat products such as skinless chicken, lean pork, lean red meat, and eat fish and eggs at least twice a week. Plant proteins including beans, soya, and tofu for vegetarians. Fats and oil should be used sparingly, the size of the tip of your thumb. Use good fats such as olives, nuts, avocado, and olive oil. Reduce your salt intake per day as this may help to control your blood pressure. Important to limit or better exclude your intake of processed and convenience foods. The last but most important risk factor is the physical inactivity. We all can benefit from regular physical activity or exercise. Regular and appropriate physical activity improve your blood glucose levels, improve your blood cholesterol levels, improve your blood pressure values, and also an overall feeling of well-being. By doing regular exercise, you can maintain your weight after losing, reduce the abdominal fat, which means the fat around your hips and stomach, and the overall fat percentage of your body. Also, you can decrease your stress levels and anxiety as a bonus. So in everyday life, please take the stairs instead of the elevator. Mow the lawn. Walk the dog. Park the car away from the shopping mall and walk to the shops. Get up and change the TV channels. Don't use the remote control. Aerobic exercise is important. Try to do aerobic exercising 3 to 5 times a week, a total of 30 minutes per day or 150 minutes per week. This can include, for example, a brisk walk, swimming, running, playing tennis, cycling, rowing, dancing, skiing, if prescribed and appropriate for your condition. Don't forget strength training and flexibility. 2 to 3 times a week, maybe light weights, stretching, yoga, Thai boxing, and Pilates. Individual targets are a very important part of good cardiovascular risk and diabetes management. So remember that you and your healthcare professional must come to an agreement and set specific targets for you, as it will differ from patient to patient. The importance of the legacy effect, as documented in various clinical trials, must not be underestimated. Aggressive treatment, such as good control of your diabetes with lifestyle changes and medication, now will have a long-term benefit for you as a person and your health. Ignore the condition now and pay a huge price after a number of years, both monetary and a health-related quality of life. Remember, you cannot turn back the clock. For that reason, invest in your health today. We can only limit our risk through being physically active, through healthy eating habits, and control of your meal portion size. Remember to take your prescribed medication, and in the end, it will all contribute to a lower risk and incidence of cardiovascular disease.